Schizophrenia is the most common psychotic disorder. The term schizophrenia is drawn from a Greek word, split mind. It was first coined by a Swiss psychiatrist Eugene in 1911. He believed the basis of the condition was the splitting apart of mind's normally integrated function. The symptoms interfere with thinking, emotions, motor behavior, and volition, which is willpower. The abnormal thinking leads to misinterpretation of reality with the development of fantasy thinking, delusions, and hallucinations. Insight is always lost to a variable degree. Schizophrenia is defined as a serious mental disorder characterized by loss of contact with reality, hallucinations, delusions, abnormal thinking, and disrupted work and social functioning. Schizophrenia tends to develop in adolescence and early adult life, and it accounts for 13% of the world's population. Incidence is higher in men before 25 years of age and higher in women after 25 years of age. It is common among those with low socioeconomic status. So, what are the predisposing factors of schizophrenia? So, according to the biological theory, it states that an inherited biochemical abnormality intends to predispose people to develop schizophrenia. There is also the dopamine hypothesis, which states that there is hyperactivity of dopamine in the brain. The sociological theory states that schizophrenia usually tends to occur among those from low socioeconomic status. We also have the psychological theory, which is related to traumatic experiences during early childhood. For example, a client who received little or no affection during normal development, they tend to end up with schizophrenia. We also have social stress, like parental tension, can predispose someone to schizophrenia. We also have external factors like trauma and infections of the central nervous system. Okay, neurodevelopment model supposes the presence of the silent lesion in the brain, which is caused by different factors like genetics, inborn infections, trauma. So during this very early development of the brain in prenatal or early postnatal period of life. Symptoms of schizophrenia are commonly described as positive or negative. Positive symptoms are exaggerations of normal functions, whereas negative symptoms are a loss of normal functions. So most clients exhibit a mixture of both types of symptoms. Positive symptoms respond well to treatment, whereas negative symptoms are difficult to treat. Negative symptoms are also the most destructive because they render the patient passive and apathetic. Overall, the symptoms fall into three major groups. The first group is the delusions and hallucinations. The second group is thought disorders and bizarre behavior. And the last group is the deficit or the negative symptoms. So for positive symptoms, clients may have symptoms of excess normal functioning or distortion. Also exaggeration or distortions of normal thoughts, emotions, and behavior, which may be accompanied with delusions, hallucinations, disorganized speech. thought disturbances, motor disturbances. So these positive symptoms, generally, they are more responsive to treatment than negative symptoms. So what are delusions? These are false beliefs that are firmly and consistently held despite disconfirming evidence or logic. Individuals with mania or delusion or depression may also experience delusions. However, the delusions of patients with schizophrenia are often more bizarre. Okay, let's discuss the different types of delusions. The first one that we have is the delusion of grandeur. So this is a belief that one is a famous or powerful person from the past or present. And then we have delusions of control. So this is a belief that some external force is trying to take control of one's thought, body, or behavior. So let's look at this example of delusions of grandeur. So remember we mentioned that this is a belief that one is a famous or powerful person from the past or present. And here we have a 42-year-old manager who believes he has a unique and extraordinary influence over world events. He explains, I have powers that others can't understand. My decisions and actions have a ripple effect across the world. Political leaders, even presidents, take guidance from what I do, though they may not realize it. I am destined to shape the future of nations, and it's only a matter of time before everyone recognizes my importance. So this is a good example of delusions of grandeur for someone who believes they are powerful enough to make such influence. Okay, so let's look at this example of delusions of control. So remember, in delusions of control, this is where someone is believing that thoughts that are not their own have been placed in their mind by an external source. That is a thought insertion. So the example that we have is of this a 32-year-old office worker who explained that I'm reading a book and thinking about the story, but suddenly it's like someone else's thoughts take over. I can only hear their voice in my head as if they are projecting their thoughts onto my mind like a movie screen. It feels like they are using my mind to show their ideas, blocking out my own. So this is a perfect example of thought insertion. So this person genuinely believes that thoughts have been inserted in their mind by an external force or source. So another example of delusions of control is where someone is believing that the behavior they are having is being controlled by an external force. For example, a 35-year-old office worker described his actions in this way. When I go to grab my coffee cup, it's my arm reaching out, my fingers wrapping around it, but I have no say in it. I just watch it happen, almost like I'm not even involved. It feels like I'm a puppet on invisible strings. When these strings are put, my body just moves and there's nothing I can do to stop it. So this is also an example of delusions of control where someone is believing their behavior is not their own. Let's continue with types of delusions. So we have thought broadcasting. So this is a psychotic symptom where a person believes that their thoughts are being broadcasted out loud, so others can hear them without the person speaking. For example, a person might believe that their thoughts are being transmitted through radio stations, so everyone listening to that station can hear their private thoughts. Or someone may think that people around them in public spaces can hear their thoughts directly, leading them to avoid crowds or social interactions. We also might have clients with symptoms where they might feel that people are responding to things they haven't actually said out loud, like assuming someone laughs or reacts to an embarrassing thought they were having internally. Then some might think technology like a device or computer is being used to broadcast their thoughts to others, or that it is controlling what they think. So these experiences can be very distressing, impacting daily life and relationships. The other type of delusions that we have is thought withdrawal. Okay, so this is the belief that someone or something is removing thoughts from a person's mind, often without their control or consent. For example, a person might suddenly feel that their mind has gone blank, believing that an external force or person has taken specific thoughts or memories away. Someone may also, some may also attribute missing thoughts to a specific entity like aliens, spirits, or government agents, believing they are responsible for stealing their ideas. We also have some, while trying to focus on an idea, they might experience a sudden stop in their thought process, thinking someone has pulled the thought from their mind. And the last example that I can give is that we have those who may believe that others are taking their personal ideas, such as creative ideas or memories, directly from their mind to prevent them from achieving their goals, or even as a form of punishment. So these delusions can be particularly disruptive. Another type of delusions are delusions of reference. So this is when a person believes that everyday events, comments, or objects in their environment are directly related to them in a significant or special way, even though there is no actual basis for the connection. For example, a person may believe that a news anchor on television is sending them hidden messages specifically directed at them. Okay, they might also think that the people they see on the streets are intentionally staring at them, interpreting these behaviors as intentional messages or signs meant for them alone. They could also interpret a billboard advertisement as containing a personal warning or as a message meant to convey something important specifically for them. Okay. Another type of delusions are delusions of persecution. Okay. This involves the belief that one person is being targeted, harassed, or conspired against, even when there is no evidence to support this. For example, a person may believe that strangers, neighbors, or even people close to them are following them or spying on them with harmful intent. Okay? Not only that, someone might believe that the government, police, or secret organizations are monitoring their every move, tapping their phones, or planning to harm them. And an individual may think that their co-workers are conspiring to get them fired or to ruin their reputation, even if their co-workers have not shown any signs of hostility. Okay. The other thing is that a person might believe that their food or water is being poisoned by someone trying to harm them, despite no evidence of tampering. So these are types of delusions. Okay, let us now discuss hallucinations. So these are sensory experiences in the absence of any stimulation from the environment. So any sensory modality may be involved. We have the auditory, which involves hearing. We have visual, seeing, olfactory, smelling, tactile, which is feeling, and gustatory, which is tasting. From these, the most common hallucination is the auditory hallucination. This is the most common from these that are mentioned. So, when you look at this most common type of hallucination, which is the auditory hallucination. So, in schizophrenia, what you are going to notice is that this person is going to be hearing their own thoughts spoken by another voice. They are also going to experience hearing voices that are arguing or hearing voices commenting on one's own behavior. Another positive symptom, apart from delusions and hallucinations, is disorganized speech or thought disturbances. So this is a problem in organizing ideas and speaking so that a listener can understand. Okay? So on this one, we have what we call as cognitive slippage. This is a continuous shifting from topic to topic without any apparent or logical connection between thoughts. We also have neologisms. So these are new, seemingly meaningless words that are formed by combining words. Another positive symptom is disorganized motor disturbances. So in this one, there's going to be extreme activity levels, unusually high or low, peculiar body movements or postures, which is mostly found in catatonic schizophrenia, but we'll discuss about that later. Then there's also strange gestures and grimaces. Let's now discuss the negative symptoms. So these are behavioral deficits that endure beyond an acute episode of schizophrenia. More negative symptoms are associated with a poorer prognosis. Some negative symptoms may be secondary to medications or institutionalization. Okay, so we have different types of negative symptoms of schizophrenia. So one of them is anhedonia. So this is the inability to experience pleasure from activities once found enjoyable, such as hobbies or social interaction. Another type of negative symptoms is avolition. So this is the lack of motivation to initiate or complete tasks, leading to difficulties in maintaining work, personal hygiene, or other responsibilities. Such kind of patients, usually they can even sit in the house for hours or days doing nothing. They are no longer interested in anything. Alogia is another type of negative symptoms. So this is where there is decreased speech output, resulting in short, often one-word responses or very limited verbal interaction. We also have asociality. So this is where there is reduced desire for social interaction, making it difficult to form or maintain relationships. The last type of negative symptoms is affective flattening or flat affect. So there is reduced emotional expression, such as limited facial expressions, eye contact, the voice may be toneless, and this type of symptom refers only to the outward expression. Apart from the negative and positive symptoms, we also have the cognitive symptoms. So the cognitive symptoms, They often impact memory, thinking, and problem-solving abilities, which can affect daily functioning. So we have some common cognitive symptoms such as impaired memory or poor memory, where there is difficulty in remembering recent events, information, or instructions. There is a difficulty with attention, which is poor concentration, where they struggle to focus on tasks, conversations, or details, often getting easily distracted. They also have challenges with planning, organizing, and completing tasks, which can affect work, studies, and daily responsibilities, meaning they have executive function deficits. Poor decision making is also among the cognitive symptoms, where they have trouble making choices, even simple ones, due to impaired reasoning and judgment. There is also slow processing speed or slow thinking. They take longer to think through information or respond to questions. Apart from that, we also have the reduced cognitive flexibility, where they have difficulties in adjusting thoughts or actions when circumstances change, leading to rigid thinking patterns. So these are some of the most common cognitive symptoms